Hello, everyone. As I mentioned, welcome to the first town hall of 2023. Hope you guys had a great festive season. Just a couple of things to keep in mind before we get started. We are recording the session. And secondly, please do mute yourself throughout the session as well. One of the things we love doing here is also seeing your lovely faces. So we'd love for you to switch your videos on so that we can see them. And lastly, we love making these sessions extremely interactive. So if you do have any questions or comments, please post them in the chat window. Or alternatively, please raise your hand as we are doing our Q&A after each speaker. Now, with that out of the way, I would like to welcome our co-founder, Pippa Yates, to give us a quick word. Over to you, Pippa.
Thanks, Kanya. Hi, everyone, and a big warm welcome to Town Hall January. For those of you who recently celebrated New Year, Happy New Year from all of us at Turn. You know, we're super excited about 2023 for a couple of reasons, right? I mean, the first one is we just feel incredibly lucky that every month we get to showcase the incredible organizations using chat to have an impact in these town halls and across our other events. And there's no surprise that we've got two incredible teams who are going to be sharing with you today. The second reason we're really excited is there's a whole wave of new technologies that are coming into the space. You'll see later today, we'll show a demo of how to integrate ChatGPT, but large language models and the like are starting to change the shape of what might be possible in the future with chat-based programs. And we're really excited about the experimentation and piloting that's going to be happening in 2023 to see how we can best take advantage of these new technologies. And thirdly, we're seeing a strong deepening in the evidence base for services that are delivered on chat that having real world impact, from increasing vaccine uptake to reducing intimate partner violence. You know, this work that we've been doing together for the last couple of years is definitely maturing. We're seeing a couple of RCTs going to be published soon, and it's very exciting to see generally this group creating strong evidence base that these tools work. And I will definitely be showcasing some of those studies as we move forward in Town Hall throughout the year. And lastly, you know, we're super excited because every year since we started these Chat for Impact events and town halls back in 2019, this community has completely exceeded our expectations in terms of what you guys have been able to achieve in a year. And so we're very excited to see what happens. And so with no further ado, I'm really excited that today we're going to be hearing from Khushbu Gupta from World Reader and Kasim Saeed from Penda Health. And they're going to be sharing their learning journeys with chat as well as their results. We're going to talk a little bit about some new updates from a Turn product perspective and what we've got in store for you. And we'll be showing demos on ChatGPT, as I mentioned, to show you kind of how we can start to leverage some of these new technologies. And so that's what we got in store for you today. So let's not wait and let's get into it.
Thank you very much, Pippa. For those of you joining for the first time today, my name is Kanya Mlungu. I lead impact partnerships for Turn. For Europe, Middle East, and Africa. And I would like to start by welcoming our newest community members who have joined since our last town hall. Now, it's great to see organizations doing work in different thematic areas, such as education, sustainability, and financial inclusion joining our ranks. And we're extremely excited to have the likes of the London School of Economics and Political Science, which Pippa is part of, Artivos, Seed, just to name a few. Now, we look forward to working with you and supporting you on your journey of making an impact. Now, as is also customary at our town halls, we showcase amazing organizations doing great work in certain thematic areas. And as Pippa mentioned, the next organization needs no introduction. We are going to hear from World Reader, which has done work in over 100 countries in the education sector. So here is Khushbu Gupta, Product and User Engagement Manager, to share more about their work and use case. Over to you, Khushbu.
Thanks, Kanya. First of all, I would like to say Happy New Year to everybody. And thanks a lot, Turn.io team, for having me. We have been associated with Turn.io from some time now, and was like a very great journey till now. Um, so my name is Khushbu. As Khana introduced, I've been part of product team in World Reader, and my work is more focused on user engagement and retention. Um, let's talk about World Reader. Globally, 64% of 10-year-old children cannot read and understand a simple story. When I have get to know about this research first time, I was scared, and this is very threatening for the future. At World Reader, our mission is to get children's reading today so that they'll reach their potential. And we really believe that when children read regularly, they'll have a bright future. And being a mom, and I have a small 1.5-year kid, I really feel when I open the book in front of her, she gets really excited seeing the colorful pictures, and I introduce her to different uh, shape, size, and pictures. She gets really interested in that. So I really feel the introduction of books in early stage of the kids, it's really improves the way they capture the world. At World Reader, what our major focus is creating a habit of reading and making children read 25 books and in an year, at least by 2025. So this is our short time goal. Um, okay, next slide, please. Yes. So in order to achieve our 25 books per year goal, one of our initiatives is driving continuous engagement through effective channels. So for this, we are utilizing our ABCD model. Through our ABCD model, we are providing app-based access to our books, activities which you can do with your kids to continuously engage them, which can and also we can measure the impact through data. So we are following this kind of model. Next slide, please. uh, Reading has actually become a global crisis, especially during the COVID times. uh, Many children would not be able to go to school, especially the underprivileged kids, and children lack the access of books and reading materials. So during this time, our world readers focus have gone to provide books to everybody, to especially to underserved communities and small kids who do not get opportunities during this time. And post COVID as well, we have seen uh, that rate of accessing education is really going down. So we integrated our systems with engagement frameworks, so that parents and children's engagement increases uh, through different ways. One of the ways which we adopted is um, introducing activities into our current reading model. So, doing some pre activities before reading a book and post reading activities after reading a book. We have also introduced Viroom tips. So, Viroom is an organization which is Bezos Family Foundation organization, which has created science backed activities, tips for the parents, which we integrated into our system. And the easiest way to reach to our users is the most effective channel, which is WhatsApp these days. We can connect to users through these solutions very easily. That's how integration of WhatsApp through Turn.io came into picture. And we have seen the number of users to whom we done a pilot in Kenya. 30%, more than 30% of users have opted in to receive our tips of the week, parental tips and activities uh, from our Booksmart channel. So to see such a overwhelming response, we decided to scale the audience in India with a partner-led project, which we will be doing in February, which has more than 20,000 students ranging from age 3 to 12. So we will be we are partnered with those organizations which collaborate with the schools and provide them books of the week. This books of the week concept is very new, very old, which we have introduced in our apps as well. So it was working very good, which has very good response on the app. So we want to do books of the week concepts in India through WhatsApp as well, in order to scale our use case. Next slide, please. Uh, the major key learnings which we have found by integrating tips and activities through WhatsApp in Kenya is, after the reminder feature in Turn.io came up, we when we started utilizing the reminder feature, we start sending the weekly tips and activities to parents through WhatsApp. It has seen through continuous interaction with the users, that is the key to drive engagement. Once because we are in the ecosystem where we need to create a habit. People are fond of reading, but if we create a habit of reading like 5 or 10 minutes per day for long duration of time, we need to be consistent, and we need to continuously engage with our user to make a behavior for the user. Another key learning for us is to make our content really interactive through audio and audio friendly and visual attractive images as well, so that uh, they will be they will understand more how we want to interact with them, and it will be really helpful for the needful or people with disabilities, and also a pleasing experience for, in fact, everyone. Another key learning for us is to really understand the user interaction and behavior, like how the users are interacting, and using the data and insights, how they are interacting was the key learning. And we what we did is we integrated our Turn platform with Google BigQuery in order to get the deep insights of how users are interacting with us, and making useful decisions according to that. So these were the three major learnings which we found. Yes, next slide is for video. So yeah, please play. So this is our workflow for tips of the week, which we launched in Kenya. So through this, we send tips every week. There are a lot of activities to do with your child. Like if you interact with them, just type 10, you'll get a lot of information about different type of categories of tips, like what you can do in the apartment, what you can do in the playground, different kinds of activities, and these activities are actually science based. Uh, yeah. So that was about, and if you want to know more about what is the science behind it, just type 11. You'll get more information from the Viroom website, which provides, which we have integrated in our platform to get uh, these activities and tips of the week. You can I'm sure many of you might have kids ranging from 3 to 12. So you can just scan this code and have a look on the how this workflow works, so that you can definitely pick up some activities which you can do with your kids, and provide us feedback. Do you like it? And if you want to change or suggest some changes in that, we will be really happy to have feedbacks on this. Um, I think that's all we have for this use case. Apart from that, there we are also doing a books of the week for India region from next month, I think. So you can definitely follow us to see what's coming next with us on chat. And the interesting part, which is coming up in our town hall, will be GPT. So we are also looking forward to see what capabilities we can add into our platform using the chat GPT, which is the hot in the market. uh, I think
Thank
that
you
will
very
be
much.
really interesting space.
Thank you very much, Khushbu. Amazing presentation, and we have tons of questions in the chat window. So,
Thank you. Thank you.
but I think because of time, I'll just choose maybe a couple of questions, 3 questions, and then we'll move to our next speaker. But then feel free to also answer the other questions in the chat window as well. We've got a question from Jemin Zubia, who's asking, what strategies do you use for onboarding, and which has been the most effective?
So for onboarding, actually, we have been using the on-site strategies. We uh, we don't directly ask user to come our WhatsApp platform, and that could be a very costlier way to do that, because we are not doing so much of marketing, being a non-profit. But the reading programs which our field users do, or the regional managers who actually work with the schools, we ask them to we promote our WhatsApp channel over there. And because they are the school, uh, and the reading program organization is there, who will pitch the readers and students, and through them they get to know about our channel, and then they onboard them on our platform.
Perfect. Then just another question for you from Pippa, which is, what is the best time of day to send these reminders about reading?
That's a interesting question, and we are doing a lot of experiment around that. Uh, So it actually depends upon in which region you are, because the culture and the work hours depends upon in which region the parents are. So because when they come back home, the or on weekends or in the night time, they used to read with their kids. But I have what I have seen using various other tools as well. We The best time to communicate, to send these messages around the evening time, 4 to 6 p.m., and also then 6 to 8 p.m. I have seen a highest number of click-through rates during this, not only for WhatsApp messages, but also for push notifications and other notifications.
Perfect. Thank you very much, Khushbu. As I mentioned, we still have a lot more questions in the chat for you, so please feel free to answer those there. And thank
Thank
you
you
again
so
for
much for
making
having me.
time and the presentation.
Thank you.
Now, up next, we have an equally recognized organization doing work in healthcare and telemedicine. We have Kasim Saeed, who's a software systems analyst at Panda Health, to share about their story and insights. Over to you, Kasim.
Thank you so much, Connor. Truly appreciate, and I'm really excited to be here. Good morning, good afternoon, good evening, and good night, depending on what part of the world you're in. And Happy New Year to you all. So my name is Kasim Said. I'm the software systems analyst at Penda Health. Penda Health is an outpatient health facility of the East African region, Kenya to be exact, and we do have 19 physical branches and a telemedicine division. To date, we've seen over 1.3 million patients. And one of the key things that we're trying to grow right now, in this time and space, and with the pandemic coming in and stuff like that, is our telemedicine space. And that's what we call Pigia Penda, and that's where our engagement with TAN actually comes into play. Okay.
If your child is sick, you need trusted medical advice, and Penda trusted doctors are here to help you wherever you are on phone. You simply need to pay Kenya shillings Andi via M-Pesa till number, and one of our licensed healthcare providers will give you a call shortly. We also offer drug delivery for all drug treatment needs and lab services across our 20 branches in Nairobi. Try Penda's telemedicine services today. If your child is sick, you need trusted.
Early in 2021, we officially launched our telemedicine division. And it was just before the pandemic struck, at least our region. And one of the things we were struggling with, or we were trying to figure out, is how do we make it easy for our patients to actually engage us, make it easy for them to access affordable healthcare that we provide, and be accessible to them at any time of the day. And we tried various things. WhatsApp was came in later on, but when we started, it was actually phone calls. And there was a deliberation of us building an app and a couple of other things. And one of the core things for us was always to figure out how do we make it easy and affordable for the patient, not only to get the quality services, but to as well make it affordable for them to actually engage us. Next slide, please. So our biggest problem at the beginning was actually that we had low patient engagements. And it was so easy for us to tell because across our different networks of physical branches, we see over 35,000 patients, or we have over 35,000 visits on a monthly basis. Our patients already trust us, and we had tried to market the telemedicine services through them, but the engagement was so low. And after a slight research, a few engagements here and there, interviews, we actually got to realize that there was an issue of affordability. I want to take a step back just to explain why we went for WhatsApp in the first place, because in the telemedicine space, a lot of people were going for mobile applications. And early enough, we actually realized that the adoption of mobile application is actually low in our region. And you might get a few hundreds of thousands, if you're lucky, on your custom application. However, it's very hard to keep a good stream of active users. And WhatsApp became the most viable option for us to not only expand our base, but also in the fact that it's actually easy and cheap as compared to phone calls and SMSs. And so we put this to the test, and that's when we actually developed all the different things that we've actually put into place. So the service that we developed for Penda or on WhatsApp is what we call Chat na Penda. Chat na Penda is a service that not only offers our patients access to trained medical providers, but as well what we've done is we've actually included a few more things that are very valuable to our users. One of those key things is actually that they can access the medical information via WhatsApp. And we've also introduced just a few months back, sometime last year, self-assessment tools. And these are different tools like, BMI checker, UTA self-assessment tool. And, we're in the process of working on a diabetes risk evaluation tool as well that will still run on TAN. Since we started, we've been able to move from roughly 20 to 50 patients a month. And right now we are averaging between 900 to 1,000 patients a month on our telemedicine services. We've had over 1 million interactions with over 100,000 users. And thanks to this, we've been able to actually become one of the top virtual care providers in the country as at the end of last year, and definitely we are still pushing. Next slide. One of the key learnings for us is that our patients are really keen on privacy and confidentiality. Being a healthcare facility, definitely we do have these concerns across the different channels that we use to provide our services. Now, the mentality that people come in when it comes to WhatsApp, and in different regions, of course, there is different scandals. You'll see different screenshots of private information being leaked on the internet and stuff like that. And people definitely want to, want to be guaranteed of their privacy and confidentiality. The other thing that we actually learned really quick, at least within the first 2-3 months, is that our patients truly appreciate or strongly appreciate human-to-human transaction. What we've done is we had a few automated elements that actually give most common information, like our locations, the services that we offer, the cost of the different services and products. However, the uptake was really low, and everything changed the moment we faced it out, and we went for human-to-human, human-to-human interactions. And then, just like any other chat services, people expect it to be real-time. And so the moment there is any delay, we realize that our patients also tend to disengage, and they either don't get the service that they require, or they actually just don't proceed with anything with us. Some of them just completely drop off. So we have agents that are manning these desks 24/7, and some of them are non-clinicians, and some of them are actually trained clinicians. And so our patients have access to both for general queries and for health advice as well, and medical consultation. And this is available 24/7. Next slide, please. So here is a demonstration of how one can actually use our services to check for their BMI, for example. And it's super easy. You just type in BMI checker. It will ask you for your weight and height, and it will actually give you your results back. And it will give you an option to actually also engage a nutritionist on our end. And you have a choice to actually not engage further. In addition to that, definitely I talked about access to medical information. In this example, you just use the keyword lab. And this is after a visit at our facility. You will get your results back once they're ready. And you always get a notification on that. And once you get it on your phone, it's password protected. There are instructions in the message on how you can open it up. And it's as easy as that. So definitely, it doesn't stop at lab results only. What happens is you can access your prescription. You can access patient education instructions. And patient education instructions to everyone is just different instructions that guide you on how to manage your condition. And so this is made accessible through our EMR system. And you can access as a patient the same information via WhatsApp, the same way you've seen on the screen. So there is a lot of things that we've actually done that we can demonstrate in this call. But yes, this is just an example, the same. Next slide. on this, you can actually scan and just test our BMI tool. We also have a UTI assessment tool. However, the majority of the other things that we actually do is dependent on you actually having a visit in our facility. And then when you have a prescription, for example, you will be able to get your prescription. You'll be able to get your lab results, as I said. You'll be able to get your medical history as well. And the moment you save this number, as much as you can check your BMI, feel free to actually consult with any of our clinicians as well. The agents are always online and they'll be able to engage you.
Thank you very much, Kasim. I think I was still waiting and wanting more from that presentation. Thank you very much for sharing that with us. We have, again, a number of questions on our chat, so please feel free to go and respond there as well. Just picking up a couple of questions for you as well. Simon asked, how did you determine what the most important value-added services were that you are needing to add to your WhatsApp offering?
Thank you for that question, Simon. The way we approached this was very user-based approach, where we actually interacted with our patients and found out from them. It was actually everything that we've implemented, other than the medical tools, actually, which were also driven by a lot of other things, like a lot of the data that we actually have in terms of all the health records that we have from our patients. Everything that the patient can access through WhatsApp was actually driven by the patient themselves. And we keep building and iterating based on the need that is coming from the patient themselves. So we are constantly keeping in touch with them. We are constantly collecting feedback. We are constantly collecting these requests and prioritizing accordingly over time, and actually implementing and putting it to the test as well. So what we do as well is we monitor actively the uptake of anything that we implement, and make decisions to either keep building on it, maintain it as is, or actually dropping it altogether and introducing other things. Yeah.
Perfect. And then another question, how many help desk operators work on the service? And maybe coupled with that as well, do you have any type of triaging that you do with the questions that come through from patients?
Currently, we have, at any point in time, we'll have a minimum of 4 and mostly a maximum of 8. It's proved to be manageable. We've not had any challenges. Queries are responded to on time. Consultations are done within a reasonable time. And yes, triaging actually happens during these calls, and we definitely have guidance on this through different channels as well. And there are other tools that we use on the side beyond even our EMR system. For example, there is a tool called Clear Triage. However, our own EMR system has enough guidance and support to our clinicians in terms of triaging even virtually as well. And definitely there is a limit to what you can do virtually. And sometimes you have to probe somebody to actually physically visit a medical facility. In addition to that, one of the services we actually offered when we realized that not everybody has the ability to visit a medical facility for one reason or the other, is we introduced another service to our telemedicine front called home-based services. So where we actually we come to you. So we'll get your location, we'll send a clinician or a lab tech to actually get samples and stuff like that. And every other test will be done at our physical facilities. And then we'll continue with the treatment and medication through our PG appender.
Perfect. Thank you very much, Kasim. Very insightful and excellent work. And we look forward to what you guys are going to be doing next, and all the best. That's it for our showcases. I will now hand over to my colleague Nilka to take us through the product. Over to you, Nilka.
Hi, everyone. It's lovely to be together on the side of a new year. It's my privilege to share our latest product updates with you. First up is Reminder Stats. And yeah, I think previously when World Reader was sharing, said that they use reminders, and I know a whole bunch of you on this call have tried it out and have also given us feedback. So I'm excited today to say that we have indeed taken a lot of feedback out of alpha and beta testing into account and updated the stats, so the details that you can see once you've kicked off a reminder. I'm just going to highlight the key changes. There's 2 steps really to sending a reminder. The first one is like, is this actually going out to my bulk set of users? Because it will take time if you do a large send, right? It might take a couple of hours to complete. So right at the top of reminders, you have clear progress saying the number of people selected, how the processing is going, if any errors occur. And then the moment that you know messages are being received by users, you start being curious, like, are they reading it? Is it getting delivered? You know, who doesn't have data and the message just isn't going through? So we also provide feedback on the message status. And that's everything on like the user end, what happens on WhatsApp itself. And you will see there's summaries on a sent rate and a delivered rate and a read rate. And I've linked our Learn article explaining all those stats. We hope that helped you, and any feedback further on these updates is welcome. You guys can just pass it on to us. We love to make it better and really make it useful for you. Then the next one is what is new in Build and new with Stacks. And I'm excited to say that you can now export CSV data from a stack. So if you open a stack, you will see an export data button next to your save stack button. Key thing to note is that you need to specify which data you want. Stacks enable very complex user conversations, and not all of those conversations are important to you. You might be saying hello and, do some introductions, and then there's specific times where you want to collect data or you're asking for feedback, and you really only need those interactions. So have a look at the documentation and the Learn updates. It explains how you use the right result function, and then it's easy to get your data and you can visualize that as you need, and you can easily see when did users start sessions and when did they complete it. So please play around with that, and once again let us know what you find useful and what you would like to see us improve on. And then other updates on Stacks, there's 2 more new functions. The one is called the Assigned Chat to an Operator, and the other one is about adding labels to messages. We've created a really cool random operator assignment playbook to put those 2 functions for you into action. It allows you to prioritize certain chats to certain of your coaches or your operators, and you can use the labeling to categorize messages into topics, and all in all really set up a triage system to make sure your whole team working together. We've just listened to Penda Health working together and really answering complex issues to users. So please have a look at the random operator assignment playbook, but don't just have a look, try it out, copy it, download it, edit it, put it to the test, and let us know how it goes. And then lastly, from product side, and it's a small update, but I mean, we've already shared 2 playbooks just in this session, and we've shared the one also from Penda Health, and we've just made a small update where when you describe your playbook and how it works, you can now easily add hyperlinks. We will share one more even today, and it links to ChatGPT, and then it's just easy to link someone out to a website and give someone context outside of your playbook. So it's small things, but those things matter. Yes, I think that's everything from my side. I'm going to hand over to Simon, who's going to take us through some ChatGPT excitement.
Yes, so we can continue straight to the next slide. We'll pause the video there for a bit and we can show it just now. ChatGPT, it's already been mentioned a few times in the call, and there's been a lot of excitement and buzz around large language models and those being integrated into various services. Just the other day, I saw on the news that ChatGPT is causing headaches for some school teachers because people are using it to answer their homework assignments, which is a whole new unexpected development. Well, maybe people would have expected it, but regardless, we are very excited about these developments. So, and we've demonstrated some voice transcription services during the Chat for Impact Summit at the end of last year, and we really feel that this is just the beginning. So what we're really happy about is that Stacks make it very easy to integrate these services, and we're really looking forward to how you all will integrate those to your services in the future. But to be honest, we need to be honest. There's still a lot to learn about these solutions and how applicable they are to our field. We really feel that there is a really that they will be incredibly useful, but we just don't know yet how. So, and it's quite easy to become enamored with technology and very specific solutions, but ultimately for all of us on this call, the real question is, will these technological advancements really help us advance our impact as a community? And to be honest, we're really looking forward to finding out this coming year. 2023 is going to be a really exciting year for us using Chat for Impact. And so we've got this demo. We've got it's a bit of a toy implementation where the WhatsApp service integrates with the ChatGPT API. Can we press play on the YouTube video and we can see how that works?
This playbook establishes a connection of Turn with ChatGPT. That means when this playbook is activated, the questions that are received in WhatsApp will be sent to ChatGPT to process, and the response from the ChatGPT will be sent to the user over WhatsApp. In order to make this playbook work, you would need a secret, and you have to replace this text with the secret. We have added a link in the description from where you can generate your own token. Now let's see this playbook in action. We have created a little spiced up version of the playbook, and you can see we have replaced the text with our own token that we generated from OpenAI portal. We have also limited the number of characters in the response to 4,000. Now let's ask a question. Say hi and how to manage diabetes. Okay, it will take a few seconds to fetch answer, and there it is. This is the answer that is fetched from ChatGPT. And that's how it works. I hope that helps.
So I would encourage you all to scan the QR code that's on your screen. You'll see it pops up with a number of pre-filled questions that we've put in there using a list button. This is all available as a playbook for you all to study and use. And so you can select one of the questions in the list as a sample question, or you can provide a free-form question yourself in response to that message. You'll notice that some of the questions in that list have actual grammar mistakes or typos, or it's unclear as to what the domain is about. For example, is this actually talking about labor law, or is it talking about pregnancy and labor? And so these systems need to accommodate these kinds of differences in context and question and all these nuances. And so for us, what we're really going to be looking at is how and when are these large language models applicable for these services, what does that mean for the impact that we can deliver, and how we can scale the impact of these services. So again, we're really looking forward to see what this year will bring in this field. We're very excited about it, and we're very happy to say that Turn makes it very easy to integrate these services into all of your impact services and numbers that you are running. So if you have questions, we can go to the next slide.
Display.
The next slide. A lot of what we've talked about is covered in learn.turn.io. If you have any specific questions, feel free to reach out to support. You can use the QR code there, or you can email us at impact@turn.io. And also just a small reminder that occasionally there are maintenance updates or system updates that are important for you all to be aware of. If you want to receive those automatically, sign up to the Turn.io status page. It's linked there, but it's also status.turn.io, where you can leave your email address, and if there is an important maintenance update, you will be automatically updated on that via email. And with that, I'm handing over to Pippa to close us out. Pippa?
Thanks, Simon. So I don't know about you, but I'm leaving this town hall feeling really inspired for the new year. We thank you so much, Khushbu, for sharing your learnings around World Reader. I think you guys have a fantastic program, and I'm so excited that you're swinging to India. It's going to be fantastic to see how you grow over this year. As we all know, India is one of the top WhatsApp markets in the world. And Kasim, I think I can talk for everyone here to say that your help desk is one of the most impressive we've seen. Your response rates are incredible, and I think we'll continue to learn a lot from you at Penda Health as you grow your service. I'm really impressed to see those that increase in the number of customers you're getting on WhatsApp compared to the voice calls. Is extremely encouraging for health models similar to yours to expand across all of the different regions. So thank you so much for sharing your learnings today with us. And yeah, so that's a wrap from us for January Town Hall. I hope you guys have a wonderful end of the month, and we will see you again for more excitement, more sharing, and more learnings in February. Thank you so much.